The National Institute of Allergy and Infectious Diseases issued a new national health guidelines this month, calling for parents to give their children foods containing peanuts early and often, starting when they are infants, as a way to help avoid life-threatening peanut allergies. As parents, we're fearful about giving peanuts to our infant and younger children. Joining me now to ease our fears and concerns over the new guidelines is Dr. Shahzad Mustafa. Doctor, could you tell us a little bit about the new guidelines and the reasons for these changes?
The new guidelines are encouraged to introduce peanuts early into an infant's diet as opposed to later, which was the previous recommendation. The guideline divides infants into 3 categories: a low-risk group that has no risk factor for food allergy, a moderate risk group that has mild to moderate eczema, and then a high-risk group that can develop peanut allergy that has severe eczema or egg allergy. In the low-risk group, parents are encouraged to introduce peanuts at will at home without any concerns whatsoever. In the moderate risk group with mild to moderate eczema, parents are again encouraged to introduce peanuts at home around 6 months of age. If they are concerned about doing this, they can certainly discuss this with a pediatrician and an allergist and potentially introduce it in a controlled fashion. Only in the high-risk infants with severe eczema or egg allergy is it encouraged to undergo testing prior to the introduction of peanuts. And this can be done potentially with blood work or skin testing with an allergist. The new guidelines are very different than the previous recommendations because the new guidelines are based on excellent science. And we're very confident in these guidelines helping decrease food allergy and peanut allergy.
Doctor, what are some of the symptoms of food allergic reactions?
Food allergic reactions, the vast majority, 80 to 90%, come with a rash, hives, itchy rash. Other symptoms can include difficulty breathing, coughing, wheezing, swelling, nausea, vomiting. You could have diarrhea, and certainly more severe reactions can have lightheadedness, fainting, passing out. The vast majority are associated with a rash.
Could you tell us a little bit about immunotherapy and how it can help a child with life-threatening allergies to peanuts?
So as of today, the only treatment for food allergies is avoidance of the food and treatment of accidental ingestions with epinephrine or antihistamines. There is a lot of exciting research going on immunotherapy, which may help decrease a child's sensitivity to a food allergy, but immunotherapy is not quite ready for prime time yet. It is being done in the research setting. We're very hopeful about it, but it is not being used widely in clinical practice as of today. And that's why the guidelines on the prevention of peanut allergy are so important, because if we can prevent these conditions before they occur, that would really be the best way to go about it.
How can we prevent peanut allergies in our children?
So early introduction of peanuts has certainly been shown to decrease the risk of peanut allergy. So by early introduction, we mean trying to introduce peanut protein into the diet by about 6 months of age, certainly before a year of age. That is the #1 thing we can do to decrease the risk of peanut allergy and likely other food allergies in our children.
Doctor, is there anything else you'd like to add about peanut allergies in our children that we haven't covered?
I think it's also important to know that young infants, peanuts can be a choking hazard. So introducing peanuts the right way. So you can potentially take peanut butter and dilute it with warm water. You can put a peanut butter mix in with pureed fruits and vegetables or cereal that the child is already consuming, or have peanut snacks like Bamba, which is a peanut protein in a puff. But you have to be cognizant about being safe while giving your children early introduction of peanuts.
Where can our viewers go for more information?
You can always speak to your pediatrician or an allergist. Online, peanutallergyfacts.org is a great resource to have more information. But again, there's multiple resources in the community. Always consider starting with your primary care doctor, pediatrician, and allergist.
I'd like to thank you for taking the time to talk with me today. Have a great day.
Thanks for having me. Thank you.